So you told us a little bit about certain pigments that are easier to remove. How effective is it?
They're pretty effective, but again, it depends on skin color, it depends on the type of tattoo that you have, and also it's financial considerations, because that tattoo laser might have cost $120,000. That tattoo that you got can cost about $50, and now you have to come in once a month for about 10 removals if it's a really dark pigment. So it gets kind of costly.
What type of result do you tell patients to expect?
It really depends on the color of the tattoo and the patient's skin color. If you're pretty light with a dark tattoo, it's pretty easy. But some of the ones in darker skin patients are a little bit more difficult, and you have to be a little bit more careful. And that kind of goes back to the training and going to a professional who knows what they're doing, because if you're dark with a dark tattoo, you need a lot of treatments at a very low energy. The minute that you start being over-aggressive, then you have a darker skinned patient with a white tattoo, which stands out, a white pigment on them, which stands out a lot more than a dark tattoo on a darker skinned patient.
So for sure, it sounds like you need multiple treatments. Does it hurt a lot?
Hurts a bit.
So, and is it more uniform as far as the technology, or is there a bunch of different tattoo lasers out there?
Well, there's a couple of different technologies out there, but you need a Q-switch device, which means that the device puts out a very short amount of energy, a very large amount of energy in a very short amount of time. And there aren't that many companies that make these particular tattoo removal devices. But again, go to someone with a real good experience.
That's very interesting. Next subject I want to talk to you about is laser lipo. Okay, so laser liposuction has been, we talked about it before on these shows, and it's something that's marketed very heavily. Patients hear about it. What is laser liposuction, and where are we with that technology?
The problem with this is that it's being marketed to every physician out there, and even dentists, to do laser liposuction. The problem is, with all the marketing, there are many physicians out there who just don't have any basic lipo experience. I mean, you need basic lipo experience before you take this hot poker and put it in somebody's abdomen. This is a more advanced device in my mind. It's not a more basic device. So with that, there's a lot of devices out there with different wavelengths. There might be a 1319 and 1064 and another wavelength. So the physician needs to be pretty picky about what type of device they use. And in addition, you have to get the right patient selection. I find that the lasers are best for people with small amount of fat, because we like to do them under local anesthesia, and you also get some skin tightening on those small volumes. If you're pretty hefty, laser liposuction is probably not for you.
And just to underscore the point, it is an evolving technology right now. So I don't think that, would you agree that we don't have the scientific data to really say exactly where it fits in, to really prove that it's clearly safe for all applications, but that's something that's evolving currently?
There's a lot of research going on with laser liposuction now. Unfortunately, it came out and they marketed the device before we had a lot of hard data. But I think it's a definite good tool for our armamentarium. The question is, where are we going to use this specific tool? Again, I like to use it for small volumes and people with a little bit of fat, as opposed to big, hefty individuals.
Yeah, I think that people like you will certainly help shed the light on where that technology will fit in.
Literally.
Yes, exactly. So before I let you go, we get questions every week from our viewers via our website and as well as Twitter, and I want you to answer a couple more questions if you don't mind.
Be happy to.
Great. So the first question is from Gina from Lynch, Nebraska, and she says, I have a deviated septum and my surgeon wants to perform corrective surgery by going under my lip instead of through my nose. Is this a better procedure? Sounds a little bit weird to me. I mean,
sounds a little weird to me.
I would say, Gina, maybe ought to go get a second opinion about most of the nasal surgery, septal surgery is done through the nose in some ways. There may be some specific circumstances that you would go through orally, but I have not seen that application.
Not really. I mean, I think if you want to maybe take off a little bit of your spine, maybe, but for the most part, I mean, we are all trained to do it through the nose.
The second one is from Diane from Waterbury, Connecticut. And she says, I am 59 years old. Since losing over 125 pounds under my chin, it is so jiggly. Or as my 6-year-old granddaughter says, it's squishy. What's a woman to do?
Well, I'll tell you what not to do. this is not a role for lasers. I mean, this is not a role for laser liposuction, and this is definitely not a role for skin tightening devices. I think you're going to be sorely disappointed. I mean, this is where you need to go to a board-certified plastic surgeon and evaluate Diane, and she probably needs a facelift.
In the weight loss of 125 pounds, she clearly is going to have excess skin that's going to need to be dealt with.
Absolutely, and congratulations on that weight loss, Diane.
And the last one's from Linda from Honolulu, Hawaii. Is there a difference between the gummy bear implant, the memory gel implant, the cohesive gel implant, and the form stable implants, or are they all the same thing?
Well, you're asking me, but you're the expert on these gummy bear implants, so why don't you answer that question?
Historically, the form stable implants, the cohesive gel implants, and the gummy bear implants refer to a new technology of a more shape stable implant. And so those are things that are non-FDA approved at that time. This time, they're under clinical trials. The regular approved non-form stable round gel implants are also called memory gel implants, regular round silicone gel implants, and those implants are readily available and FDA approved, but they are different from these more form stable or cohesive gel gummy bear devices.
But do they feel firmer, or are they as soft as the other implants that we normally use?
Well, that's, I think that that's still something under evaluation, but I think that they are a little bit firmer. Certainly in your hand. The question is in the body where that fits in. I think that patients probably do have a little bit more edge palpability with the form stable or cohesive gel devices than a non-form stable gel device. And certainly no implant is the perfect implant. So patients need to be evaluated and procedures selected and then move on from there.
That's good.
So Jason, it's really been great having you, sharing your insights, particularly about lasers. Really appreciate it, and we hope you'll come back and spend some time with us again.
I would love to. Thank you so much, Bill.
So we'll end with our recurring PS Talk vibe, and that's where we look at viewer comments. I've got 2 comments from our last segment on breast reconstruction. This one from Wendy, who says, I was disappointed not to hear the medical doctors on your program correct Rebecca when she proudly stated she had no evidence of disease, as if to imply a patient that has lived for a few years past their diagnosis is cured. Not a good message to send to patients who are grabbing on hope at every juncture. Well, Wendy, certainly that wasn't our intention. I certainly didn't take it that way, but patients, and I've treated a lot of breast reconstruction patients, it's a big milestone for them to get the diagnosis of no evidence of disease. And even though they do need to be followed, we're very happy for Rebecca and still would congratulate her. Valerie says, thank you, Becca, for sharing your story. I also was not told that immediate reconstruction was an option. Fortunately, I found out about it on my own before meeting with my breast surgeon for the first time. I had to ask for it. It isn't fair. Well, Valerie, that's precisely why we ran that show, and we hope that it will help future patients find out about breast reconstruction. But we appreciate your comments. Thanks for joining us today. If you have any questions about this episode or others, go to the Plastic Surgery Channel homepage and click on the Ask the Doctor link. We'll be answering your questions on future episodes. You can also send us your messages on Facebook or your tweets on Twitter. That's all for today. We'll see you next time.